A podiatrist is a doctor dedicated to the study, diagnosis, medical, and surgical treatment of disorders to the foot, ankle, or any lower body part. They check for skin color changes, elevation in skin temperature, swelling, pain in legs, open sores, ingrown toenails, bleeding calluses, or dry skin. Diabetic patients suffer with more sensitive feet. The podiatrist can help a diabetic by prescribing specific medications or with simple things like removing sores, cleaning calluses, and cutting toenails. An ophthalmologist is a doctor specializing in eye and vision care and dealing with the anatomy, physiology, and diseases of the eyeball. They check for changes in blood vessels of the retina, which is also called diabetic retinopathy, which is very common in diabetics. High blood glucose levels also negatively affect the eyeball by weakening the walls of the blood vessels in the eye. An ophthalmologist can help diabetic by prescribing medication, performing surgeries, or just doing a routine checkup.
When doing this project, we had time to sit down and call a doctor named Dr. Richards. We asked Dr. Richards the question of what kind of exercise should a type 2 diabetic do. He suggested that a type 2 diabetic person do an exercise that burns calories but does not build muscles. Exercises such as running, walking, swimming, and even jogging. When exercising, you need to make sure that you do about 30 minutes a day. You can split your exercises up in intervals. Say you have a doctor's appointment at 2. You start your exercises 15 to 20 minutes before you leave. You go to your doctor's appointment, and then you go back home and you finish your exercises for however much time is left. When exercising, be sure to set goals. Say that you need to know what you do. You can write it down in your phone since we are in the 21st century and everybody uses their phones for everything. But you can also write it down on a calendar you have at home or even on a piece of paper that you look on at every single moment of every single day. Don't rely on housework for exercises. It doesn't help, and it basically just is not an exercise that anybody considers. Exercises help your blood sugar levels, so it is highly recommended by every diabetic doctor who deals with diabetes every day. So during the course of this project, like I said, we had time to sit down with Dr. Richards, who is a close, personal, family doctor of my family. So during the course of this phone interview, we had time to ask him 3 to 4 questions. We asked him first a couple of different types of medications and asked him how they worked. One he said was called metformin. Metformin is recommended for most patients. You take about 500 milligrams to about 1,000 milligrams twice a day. This decreases the absorption of glucose. Some side effects are unusual tiredness, dizziness, severe drowsiness, chills, blue or cold skin. So blue or cold skin means such as when you have frostbite. Frostbite makes your skin blue, and it is always very chilly when to the touch. Next is you have muscle pain, fast or difficult breathing, slow or irregular heartbeat, stomach pains with nausea, vomiting, and even diarrhea. Another medication is glimepiride. It helps patients who cannot control their blood and sugar levels by diet or exercise. So if you can't do the recommended 30 minutes of exercise a day, then your doctor will recommend glimepiride to help. You take 1 to 2 milligrams once a day, 8 to 12, or even 8 to 12 milligrams once a day. You can split this dosage up into intervals throughout the day. So some side effects are nausea, upset stomach, stomach pain, vomiting, diarrhea, dizziness, headache, tiredness, increased skin sensitivity to sunlight, itching, or even skin rash. The third medication is called Invokana. Invokana loses sugar through your urine. You can take your doctor will recommend 100 milligrams once a day to about 3,300 milligrams a day. This has some side effects of urinary tract infections, increased urination, yeast infections, vaginal itching, thirst, constipation, nausea, fatigue, weakness, skin sensitivity to light, and hypertension reactions, including skin redness, rash, itching, hives, and even swelling. Another question we asked Dr. Richards was, what should you watch when you have type 2 diabetes? He said you should watch your carbohydrates, which are basically any sugars you eat. You don't want to eat too much, but also you don't want to eat too little. You also want to watch your total calories. You should cut back mostly on your carbs, and yeah.
Having type 2 diabetes can affect body systems. For example, in the digestive system, there's a disease called gastroparesis, which means it takes the stomach too long to empty its contents. Now, in idiopathic gastroparesis, there's no known cause for this, but the result is damage done to the vagus nerve. Treatments can be taken for this, such as metoclopramide, which stimulates stomach muscles. And you can also go see a dietitian, and they could help you figure out foods that are easier to digest. In the cardiovascular system, there's a disease called arteriosclerosis, which is a disease in the arteries caused by the intake of fatty foods. Causes are high blood pressure, high cholesterol, or smoking. A treatment you can take is called ezetimibe. Which works by reducing absorption of cholesterol in the intestines. Due to the high intake of fat, starches, and sugar, plaque from the food builds up and slowly collects in the arteries, leading to blood flow risks, such as strokes, heart attacks, and peripheral vascular disease.
As a diabetic, you have to monitor your carbohydrate and calorie intake because carbohydrates are sugars, and sugar higher your blood sugar level, and that's not good for a diabetic because their insulin is either not produced or doesn't respond properly. So for some meal plans, for breakfast you can have a cup of unsweetened almond milk, and almond milk and soy milk over dairy milk because there's less sugar. But if you do dairy milk, then you have to do like fat-free or like low fat. And then half a grapefruit. All fruit is good, and eating fresh fruit is better than eating canned fruit or fruit in a cup because there's a lot less sugar. There is still sugar, but it's natural sugar. And then a cup of plain Cheerios, and pick plain cereal over like other cereal because there's less sugar and less carbs. And if you are gonna do like a sugary cereal, then make sure that's a smaller portion. For a snack, you can have a cup of cantaloupe, and like I said, fresh fruit is better. For lunch, you can have grilled shrimp skewers over a white bean salad. Both beans and shrimp are great sources of protein, and a whole wheat pita bread. And whole wheat is better than white because white flour immediately when it gets into your system turns into sugar and carbs, so you just want to stay away from white flour. And a cup of 100% orange juice. If you do other juices, make sure that's also a smaller portion because other juices normally have additives like added sugar. For an afternoon snack, 2 celery stalks and a teaspoon of natural peanut butter. Peanut butter is a great source of protein and stabilizes the blood sugar. For dinner, half a cup of cooked brown rice, and brown rice over white rice again because the white flour. 2 cups of steamed carrots and a non-marinated 6-ounce steak. For breakfast the next day, you can have 2 eggs. That's a great source of protein, and turkey bacon because bacon is like normal bacon is a lot less or has a lot more fat. For a morning snack, a fruit and nut bar, and that would be over like a granola bar because granola bars have a lot of sugar. And for lunch, a chopped salad with chicken or any other toppings. It's a source of vegetables and protein. And then 2 tablespoons of a low-fat, low-calorie dressing. And then a small tangerine, and those can be altered for other fruits. An afternoon snack, a cup of non-fat vanilla yogurt, and that could be sweetened with Splenda, and fresh fruit or nuts could be added. For dinner, a cup of steamed Brussels sprouts or any other vegetable. Try to stay away from corn though because it has a lot of sugar. Grilled chicken, and make sure that you stay away from fried or breaded chicken or other meats because that has a lot more carbs. And then a medium peach or any other fruit. Breakfast the next day, a whole wheat English muffin, because whole wheat, once again, no white flour, a cup of coffee, and that can be altered with natural sweetener like stevia, and a low-fat creamer, half cup of blueberries, and a teaspoon of fat-free cream cheese or sugar-free grape or strawberry jelly. For a morning snack, a small apple. Lunch, a can of unsalted tuna fish and a handful of crackers, but make sure that you watch the carb count, and half a cup of fresh fruit. Snack, a medium peach. For dinner, half a cup of cooked quinoa, and quinoa is better than rice because there's no flour at all. And then an 8-ounce salmon and a nectarine. Breakfast the next day, half a cup of unsweetened, no additives oatmeal, but that can be sweetened with Splenda, and you can add fresh fruit and walnuts or whatever. For a morning snack, a kiwi. For lunch, a tossed salad with a tablespoon of low-calorie dressing and honeydew melon. For the snack, a cup of blueberries. For dinner, hamburger with no bun, but if you do want to have a bun, then make sure that it's whole wheat. And you can have condiments and toppings, but stay away from processed cheeses. Half a cup of mango. For breakfast, a scrambled egg, whole wheat toast with a tablespoon of no sugar added jelly, half a grapefruit, a cup of skim milk. For the morning snack, a cup of mixed nuts, which are a great source of protein. Lunch, half a cup of unsweetened applesauce and avocado on 2 slices of whole wheat toast. Snack, 1 cup of baby carrots and a tablespoon of plain hummus. And hummus is made out of beans, which is, again, a great source of protein. Just make sure that you go for the plain hummus. For dinner, a 6-ounce steak and a sweet potato, because normal potatoes have a lot of starch, and then a cup of steamed carrots. For breakfast, again, a whole wheat English muffin, a tablespoon of peanut butter, and a tangerine. And then for the snack, a nectarine. For lunch, a baked chicken breast with a cup of watermelon, and again with the baked over fried and breaded. For snack, a 6-ounce cup of non-fat yogurt. For dinner, 3 crab legs and half a cup of cooked brown rice and a cup of cantaloupe. For breakfast, you could do a breakfast burrito, which is like a whole wheat tortilla, 2 slices of turkey bacon, an egg, an 1/8 cup of shredded cheese. You can alter those out for whatever. And then a plum. For a morning snack, a cup of strawberries. For lunch, a veggie roll, sushi, and an apple. For a snack, a 3 ounces of carrot sticks and 2 tablespoons of hummus, and then a cup of tossed salad, a tablespoon of low-calorie dressing, 2 baked chicken legs, half a cup of cooked brown rice, and a peach for dinner on the last.